So I had kind of low expectations and was a little bit skeptical. Not skeptical of the work, but really just of something that might be new to me. I've been working with patients that are using cannabis. I do a lot of osteopathic treatment, which involves a sensory and palpatory experience of the autonomic nervous system. I've seen thousands of patients. I've medical directed 3 clinics that have basically treated about 18,000 patients. I have a background in hypnotherapy, so I really didn't know how much of this would be new to me. And also, like, from an intellectual academic standpoint, I've written a book on cannabis for clinicians. I've read hundreds or maybe thousands of scientific publications on the topic. And despite all of that, I was really blown away, just super impressed by this work. The training was incredible. I'm super excited about it, and not just this model, but the broader potential for cannabis to be applied as an adjunct to various somatic and psychotherapy approaches. So yeah, the work is incredible. My personal experience receiving the sessions was profound and quite healing for me. The demonstration of the body's innate healing mechanisms and self-corrective mechanisms that's just so obvious with the PSIP model. It's not subtle. It's not something that requires years of palpatory experience and sensory training to really observe. It's right there on the surface. Probably what I found most notable in the course was my own firsthand experience with the work, especially during a cannabis supported session where I had several waves of autonomic release, and I could feel my body and mind reconfiguring. I had some re-experiencing of very early infant type memories that were profound and had an immediate impact on my relationship with my mom, who's in my life right now, and my relationship with myself. So I think that was the most profound, is being a recipient of the work, and also just watching the kind of like light bulbs go on in the other members of our training cohort as they witness something that's been so interesting and sacred to me, which is this innate healing mechanism just like being unleashed and doing its thing. Something that I've been excited about my whole life, and to see everyone, a lot of people see that in a way that they haven't witnessed it before, was really exciting. What I saw in this work is that cannabis can be used in a very intentional way to really open specifically the doors that allow this kind of more profound change to happen in the course of a 2-hour session. And so I think that a lot of what might take weeks or months or years for some people who are kind of using cannabis in their life and also engaging in non-pharmacologic therapies or just life itself, which can be therapeutic, I think that this is a way of really bringing that all together in a concise healing modality that I haven't seen the long-term outcomes yet, but what I suspect, based on what I witnessed, is that this is going to produce a profound change that will be sustained for patients. Yeah. I think the greatest value of combining cannabis and the PSIP model is to help patients kind of overcome a traumatic event or memory or pattern that has kind of been stored both in their body and mind and has been limiting them. I think that's kind of what we're working for with many modalities, and I think that this is just a brilliant, very effective and powerful yet safe, combination of other systems that can really support that. I mean, I'm very excited. Since the training, I've thought I wish that there were people here that were already, trained and practicing, because I've got patients that I'm ready to refer for this type of work. I know that a lot of my cannabis using patients that have really loved this plant and have made great changes in their lives and really become a lot healthier through the use of this plant, they're going to be trusting of what this plant brings to them in this new context. And it's not a terribly new context. I feel like a lot of my patients have probably started to go there in their experience with cannabis, but haven't gone all the way through because they didn't have that person with them, supporting them, who had the training to allow them to make that change. And so I think, cannabis on its own is wonderful, but cannabis in this context is extremely powerful.
Perfect.
Well, I've already started talking with some of my colleagues that are experts in the field, and getting them excited about what I witnessed, basically just explaining how cannabis can be so helpful in this, kind of moving from dissociative states out of them through a healing path. And we've all got our wheels turning, everyone that I've talked to, about how this might happen from a neurophysiology standpoint, and what we've observed over the years in our practice that kind of supports what I observed recently in this course. It's extremely exciting. I'm not surprised that cannabis has, new things, right? I'm constantly learning more about it. It's, as much as we know, I suspect it's still just the tip of the iceberg. And I'm super excited to see it used in this way. I highly recommend this training. And even if you don't think that you're going to be using this work in your clinical practice or whatever line of work that you do, I think just having the experience and witnessing it is powerful and profound. And the way that the training was held was incredibly supportive, and really produced a quick, in 5 days, I feel like I gained so much from it, but it wasn't rushed either. So it was a really beautiful experience for me. And again, I came in with low expectations, and I was just really blown away, and so thankful for the opportunity, so thankful that the training came to my town for me to experience it. So really strong recommendations for any type of clinician. And I think that this is a modality that offers so much. I think it's really important, so I strongly encourage people to check it out.